There's a lot to consider when you start planning for retirement, like choosing a start date, completing the application process, and financial planning. Another key decision will be choosing your post-retirement extended health care plan. This video will guide you through key factors to consider when comparing extended health care plans. The best place to start when exploring coverage options is by considering what you need today and what you might need tomorrow. Think about these questions. What services do I need at this point in my life? What services do my spouse and any dependents at home currently need? And as time goes on, and my spouse and I grow older, what services will become important to include in our extended health care coverage? For example, you may need physiotherapy early in your retirement. But as you age, prescription drugs often become your biggest expense. When reviewing coverage options, you should consider what prescription drugs are covered, and is coverage broad or limited? It's important to know that Canada has a wide range of prescription drugs available, but some plans only cover medications that are listed in the BC Pharmacare formulary, which includes just a portion of those drugs. So if a medication you need is not included, you will be responsible for paying the full cost. You should also think about your needs for vision care, medical supplies, and paramedical services like massage therapy or chiropractic care. Using these services can add up, and you'll want coverage that helps keep out-of-pocket costs manageable. And finally, it's important to look at the annual and lifetime maximum limits of different plans and think about whether they'll meet your needs as those needs change over time. The College Pension Plan's extended health care coverage supports members throughout retirement. It's available to you, your spouse, and your dependents when you retire. Deciding whether to join happens when you submit your application. The College Pension Plan's extended health care plan covers a broad range of medications, more than the BC Pharmacare formulary and many other plans. You'll benefit from competitive annual and lifetime maximum limits. It also offers reasonable and competitive coverage for vision care, hearing aids, paramedical services, hospital stays, and more. Of course, coverage is just one piece of the puzzle. Extended health care costs increase every year. The coverage offered by the College Pension Plan is designed to effectively manage changing costs and maintain affordability over time. It does this through regular usage reviews and by adjusting different costs, like annual deductibles and reimbursement levels. Annual and lifetime maximum limits also help manage costs, which keeps the plan sustainable. Because of these features, the extended health care coverage through the College Pension Plan provides great value for a competitive monthly premium. Starting January 1, 2026, the annual deductible will be $200, but it does not apply to vision care or hearing aids. Once you've met your deductible, the reimbursement level determines how much of your eligible expenses will be covered. Reimbursements are 80% for prescription drugs, 80% for paramedical services and for medical supplies, and 100% for vision care and hearing aids. The annual maximum limit is the total amount of coverage available to you per year. For example, the annual maximum limit for prescription drugs is $20,000. The lifetime maximum limit, which is the total amount of coverage available under the plan, is $150,000. When considering your options, look for a plan that provides coverage that will meet your needs both today and in the future. Remember, check if the plan offers comprehensive drug coverage that can meet your changing health needs. Review the annual and lifetime maximum limit. Ensure coverage for vision, hearing, paramedical services, plus medical supplies is both reasonable and competitive. Finally, confirm there are safeguards to manage rising costs and keep premiums affordable. The coverage offered through the College Pension Plan includes them all. It's designed to support your health and your budget, now and in the years ahead. It's important to know that unlike your employer-provided extended health care coverage you had when you were working as an active member, you'll be responsible for paying the full cost of the premium. That's why it's important to understand the coverage and cost of the plan you choose in retirement. A dental plan is also available. You can choose to enroll in either the health care plan or the dental plan, or both, depending on what works best for you. If you do not enroll when you apply for your pension, you're only eligible to enroll later on if you've had continuous coverage in a different extended health care and or dental plan since your retirement date. Ready to enroll? Visit the College Pension Plan website and check out the guide, Retirement Health Coverage and You.